Everything in English, so we never look back.
Hey everyone, we're gonna get started. Good afternoon. I'm Adam Romero with the Williams Institute, and I lead the organizing of our speaker series every semester. This is the final installment of our speaker series for fall 2019, and I'm very pleased to introduce Ilan Meyer, our distinguished senior scholar of public policy at the Williams Institute. Ilan is a psychiatric epidemiologist who has, among many other contributions, pioneered and developed the minority stress model as it applies to sexual minorities, and has helped extend that model to gender minorities as well in the United States. And as you'll hear about in this presentation, now thinking about that model in Colombia. Ilan has won many awards and accolades for his work, including from the American Psychiatric Association. And he's also testified in several cases, including Perry versus Schwarzenegger, which is the case here in California that struck down Proposition 8 as unconstitutional. He's also a wonderful colleague and very productive, and I'll turn it over to him to introduce the remaining panelists. Before I do that, though, let me just note that for anyone who's not already on the Williams Institute's email list, please join that. Actually, I think maybe you will get automatically joined by signing in today. But if not, you can also join it through our website and find out about all of our events and all of the research that we produce. And with that, let me turn it over to Ilan.
Okay, great. Thank you so much, and thank you for coming here. We also have live streaming. I hope it's going well. I have no idea, but if you're joining us in live streaming, welcome. I don't think there's any opportunity for live stream questions and answers. But if you want to contact me later, you're welcome to do that. So we're going to talk about the study that we conducted in Colombia with the Williams Institute, and Serfilis is Free, the organization from Barranquilla, who you're going to meet the presenters in a minute. And this presentation is based on a report that we're in the very last stages of finishing up, and we'll publish in Bogota on December 4th. Well, Bogota will be the unveiling, but it will be published all over the internet on December 4th, and in Barranquilla on December 5th. And it will be available on our website. The authors are listed here in alphabetical order, but today we have a presentation where I will discuss some of the methods and how we got to this data collection. Then Prince Torres will talk about some of the demographic characteristics of our sample in Colombia. Amy Ritterbusch, who is a colleague from the School of Public Affairs, who has been doing research in Colombia and has been one of our advisors and reviewer and collaborator, will present some data from a different study on violence, which is overlapping with our study because we also asked a lot of questions about violence. And then Jennifer Flórez-Donado will present about some stress and health. Because of the time constraint, we're really just presenting little bits of information. And as I said, I hope you will, if you're interested in this topic, look it up later when we have the full report on our website. So then after all that, I'll come back here for some conclusions and recommendations that we made, as well as any questions if you have any. So first, talking a little bit about introduction and method. So we proposed this study to be conducted in Colombia, because Colombia is a very interesting country as it comes to LGBT issues and LGBT rights, because on one hand it is one of the most advanced in terms of the legal situation of LGBT people, and the Williams Institute has conducted a review of the legal status, which is also part of our report that will be published next month. But on the other hand, it is also a country where, certainly in the past, there has been a lot of violence directed at LGBT people, in particular transgender women and gay men, but in general at sexual and gender minorities. So we'll talk about that. So that kind of combination is really interesting because we always strive to create structural changes in the United States or in any country. And I think that demonstrates something that I've been thinking a lot about, which is there's some connection between law and the kind of experience of people who are subject to those laws, but also there's some disconnection. And we've been writing about this also in the context of the United States. One of the things that we found is that there was very little empirical data on LGBT people in Colombia. There is no data collection system that includes questions about sexual orientation and gender minorities, such as certainly not the census, which also in the United States does not collect information like that. But other studies that we have in the United States, like health rare studies, a variety of other surveys, either national or state or city, across the United States, collect information about sexual identity, sexual and gender identity, but we do not have that in Colombia yet. I mean, I don't know, I'm going to make the scoop announcement on that, but as many of you may have seen, Bogota just elected the first woman and the first lesbian as mayor, and it was big news, and then it was even bigger news because she kissed her, was it her spouse? Yeah. And that created a huge controversy because the very passionate kiss was published on all of the newspapers, and so these issues are certainly being discussed in Colombia. When I was there was another kissing in Bogota because a gay couple were forced out of a mall because I think they were holding hands, and then the groups there did a demonstration like a kissing. So these issues are very active, and I think Amy will also give us some more background around how the violence fits into that. I don't know how much you know about Colombia. Some of you probably do, some of you know. Colombia's history with the paramilitary group. So all of these issues are overlapping in many ways with LGBT issues, have come politically to be discussed even in the context of the peace agreement. So it's complicated issues. So we wanted to do a survey that just gives general information about the Colombian LGBT population, describe some of the stressors that they experience and some of the impact on the health of the people, LGBT people, and also to some extent look at some issues around the connection with the LGBT community in Colombia. Our method was basically a method that has been in a lot of studies in the United States. Certainly before we had national and state and city surveys that included, there were population surveys. Most of the information we knew about LGBT people in the United States came from community studies. And this is what this was in Colombia. We did a nationwide community sample where we recruited people from all over, from anywhere we could. So the idea about community samples, you need to try to do, to avoid bias, but not selecting any one source of information, right? So we didn't want to go just to the gay community center and get everybody who goes there because that would be more biased than just opening it up as much as we could and hearing the experiences of as varied a group of people. As I'll show you in a minute, we were successful in some ways and unsuccessful in others. The bias in this method is that, or the inherent bias in this approach, is that, first of all, we're reaching people with ads like this. They have to be identified as LGBT. They have to be able to connect with that. They have to notice it somewhere, right? So if you're totally closeted, or if you're not aware that the rainbow flag symbolizes LGBT, you might not be reached. So in addition to that, the greater your participation in whatever venues that we chose to publicize our study is related to your chances of being part of the study. So that's a different from a population-based study where you call people at random or things like that. So this is the potential bias of studies like that, including this one. This is just some pictures for one of the recruitment events in the Barranquilla Carnival, which is a huge, major event with a lot of people, both gay and straight, but this was the gay night, I think, right? So there's a gay, prior to the carnival, there's different nights and different groups.
But it includes all LGBT.
Right. And this was a picture of the t-shirt that one of the recruiters posted, and this is the recruiters giving handbands with the information about the study and with the link to the study. So this is just one example. Again, one of the recruiters talking to one of the participants in the carnival. And this is Jenny, who's going to talk in a minute. She was interviewed by a major television network. So those were also helpful for us in publicizing the study. So it was not only what we did. This is what we call in-person recruitment. A major source of recruitment was also the online, through Instagram, Facebook, any kind of mechanism that we can. And one of the major things in Colombia, as in the United States, is the role of influencers. I don't know if you're familiar with that term. If you're over a certain age, you might not be. So the influencer are people who are on Instagram or other social media who have huge following, and anything they write, hundreds and thousands of people may see that. So they helped us as well. We had several influencers who published the slide that I showed you before with the information about the study, and other people therefore were able to link to the study. The survey itself was done online, so once you linked into it, you can answer the questions. And it was pretty comprehensive, so it could take 20 to 40 minutes depending on your ability to do that. You could do it at one time, or you can go back and do it over a few days. So everybody was eligible if they were identified as LGBT, so we asked them and they told us there's no other way to ascertain what people's identity is. They had to reside in Colombia. They didn't have to be born in Colombia or citizens or anything like that. And they had to have education of 5th grade or more, so that they can at least read and understand the. Of course, it was done in Spanish, and it was self-administered. All the surveys were anonymous, so we didn't ask people to give us their name or any contact information, and that was to protect their confidentiality. And the recruitment lasted about 5 months, from February to July this year. This doesn't look as good. It looks like it's all floating in the air, but there's actually a light blue border. So this is Colombia, and what this shows is that our recruitment was very successful. By the bigger, this is Bogota, the number of participants we had. So this is more or less the whole country that you don't see the border. We had no respondents in these more remote areas. We were able to get at least one respondent in the Amazonas, which is a very remote part of the country, and even 5 respondents in an even more remote part of the country, which is, I don't even know existed. It's like all the way near, what country is it?
Guatemala.
Near Guatemala. So it's all the way up in there. So that was very encouraging. That we were able to reach to such a broad audience. Of course, as you can imagine, they were concentrated in the big cities. So overall, 7,410 people answered the questions, and of them, 5,304 people were eligible, meaning they met the eligibility criteria that I mentioned, their age, their education, and their identity. Some people were straight or didn't meet other criteria. And out of them, we deleted 437 interviews because they had more than 90% of their interview missing, so we couldn't use it. But by various statistical procedures, we were able to fill in, it's called multiply imputed data, where we create a lot of different versions of the sample to basically predict what people who had a missing question, if it was not as high as 90% missing. If they had a missing question, we were able to include them, even though there were missing questions. So our final sample had 4,867 people. Those of you who are familiar with the imputation, we also tested against that what happens if we just remove people versus impute them, and the findings did not change, so we determined that we can do the imputation. So in all, the final sample has 1,243 cisgender and gender non-binary gay, lesbian women, 895 cisgender and gender non-binary bisexual women, 2,163 gay, lesbian men, also cisgender and gender non-binary, 334 bisexual, and 232 transgender of all sexual orientation. So you didn't have to be gay. Obviously, if you're transgender, you're included regardless of your sexual orientation. And within this, there are 307 people who said they're gender non-binary. So they're included in the category based on their sexual orientation. So now I'm going to move it over to Prince, and she's going to tell you a little bit about the demographics of the sample. As I mentioned before, when you listen to the results, you have to understand that we were much more successful with the younger groups than with the older groups, and that had to do with some of the biases, as I said, inherent in our methodology. So some of the analysis we stratified the data by age so that you can see how different age groups behave. So, Prince?
Well, as Ilan mentioned, we are talking about Colombia, my country. This is a country of 48 million people. Right now we have 2 million more is Venezuelan people. We have a very huge migration from Venezuelan people to our country. That's why my first slide has the Venezuela's flag, and it comes with a number. That was the number of participants of Venezuelans in our study. This is the largest study of LGBT people in Colombia. That's why it's so important that UCLA and the sponsors take the time to do a research in our country with all the history of armed conflict, of violence, discrimination. So I'm proud to be here, and I'm going to show you the demographics information. So we have 4,809 of Colombian participants and 58, as I said, of Venezuelans. And also 5 transgender, transgender Venezuelans transgender, and 227 of Colombians. Talking about education, we have the perception in Colombia that most LGBT people do not have enough education, or they don't have the possibility to go to college or to have different education from others. But what this study found is that, for example, LGBT people is increasing in the average of participation in college and also in technical school. I'm going to explain what is technical school. In Colombia, you can go to school and to finish the high school, but then you can take a technical school that is like a vocational course that it takes just 1 year. Or if you have enough money and you have enough time and enough effort, you can go to a college. But in Colombia, for example, just the 22 of Colombian people has a degree, a college degree, and just the 38 people in Colombia in general go to the universities. And right now we have the 43.5 of LGBT that is going to the university. So the number is really amazing for us. For the trans, it's a little lower. It's 24.7. For the technical school, this was something new. We didn't know that, for example, the transgender people is more oriented to the technical school, but that's what we found, and it's okay, it's good. And also it's increasing in postgraduate education. Talking about religion, Colombia is 85–90% Catholic. So we can see here that LGBT people, half of them, almost the half of them is Catholic, even if they don't go to church, because most of Catholics, I include myself, we always say that, oh yeah, I'm Catholic. But how many times do we go to the church? Marriage, churches, something like that, but we are not very frequent with this. About Christian, that Ilan asked me, but what is Christian? Christian is not the same as Catholic. No. In Colombia, we have a really really hard division between Catholic and Christians. Christians are more like Protestant, like very strict and Orthodox Catholic people. So they are very strong with the LGBT people. Catholic people used to be more softer, you know? It's like we allow them to go to the church, we are not judging you, but it would be better if you can change. So, more or less, that would be the explanation. But they are not punish you that hard as a Christian. For trans, is more or less the same. It's Catholic 49%, Christian just 0.1%, and other religions is 22.35. In others, we can say like spiritual or Jewish or other things that they decided in the test.
Prince, are the other 30? What are the other 30%?
Oh, they are witness of Jehovah, or atheist, or
Secular.
yeah, those kind of things. Talking about employment. Well, as Ilan explained, we have divided every category in different ages. First is 18 to 29, and the other one is 30 or older. So for full-time employee, and this is also another question about Ilan, he told me, why you just are checking the full-time employee? It's because in Colombia, most of people have a full-time employer, or you don't have a job. It's like there are not enough possibilities to have like a part-time job like in America. Most of the time, we are going for a full-time position. So in most of the time, you are not always just a full-time. It's like really full-time. You are not working just 8 hours per day. You are working like 10 or 11. So you don't need a part-time. You always need full-time. So that's why I just add to this slide the full-time employee. So what we can see here is that men has more full-time positions. That's what we can see here. And also, well, we are increasing in our employment. Because, for example, nowadays in Colombia we have like 10% of unemployment, so we are increasing. This is about trans. We can see 20% is they have a full-time job, and the 17% is unemployed. We are going to see this number of unemployment in LGBT in next slide. Incomes. In Colombia, for example, in 2014, most of the people in general earn less than a minimum wage. This is 2019, and the study shows that it's almost the same. That, for example, here, the 51.8% of the youngest and also the 13% of older than 30 are earning less than a minimum wage. That is, in dollars, like 232. In Colombia will be like 800,000 pesos. That is not too much. And between 294 and 1,176, we just have the 23.9% for the youngest, 47.9 for 30 and older.
This 232 for what? For a day, for a month, for a week?
This is month, incomes per month.
Okay.
In Colombia, we never talk about annual incomes. We don't know. If you ask me, Prince, what is your incomes per year? I don't know. I just know what is the income per month. And most of Colombia, we never talk about annual incomes. We don't know, really, we don't know. We just need to multiply, and then do the deductions and everything, or something like that. So what you can see here is that LGBT people is not earning too much. But in Colombia, for example, for a family, it's not very different. It's like the average for a family is like $800 per month for a family. So it's not too much. Also for trans people, it's 47%. It's not earning even a minimum wage. And the 31% is between 233 and 300. So we are not earning too much. About occupation, we have also that sense and thought that in Colombia most LGBT people, they are maybe in the streets, or maybe doing some hairstyles and everything, or they don't have like a formal jobs or something like that. But it's not. We are 35.8% of LGBT are working on sales and services. It means that it's increasing the formal positions that LGBT is doing right now. Even though we have 23% of unemployed and 10% for the 30 and olders. And 18.4% are students. So we saw in I think the third slide, that 44% of our LGBT people are involved in college studies. So this is a very good thing that the study found. About the transgender, like I said before, we have the 17.8% of unemployment, 7.6 of them are students. So the number is lower than LGBT. Most of them, as LGBT, are in sales and services, so same category. Socioeconomic strata. In Colombia, we have a division in strata between 1 and 6. This division was made at the beginning by the government to set the neighborhood, the strata for public services. So, in the strata 1, 2, and 3, they will receive like a subsidy for the 5 and 6 strata. So the 1 to 3, they receive lower incomes. So the 5 and 6 that are the one that earn more money, they will subside the poor people. Okay? So, but this division, a part of do something like for neighbors, for neighborhoods, it just make a division for people too. So it's also like something that comes with the personality for the people. So how they feel, if they feel what strata they feel. So this is also something that you can see in the universities. So you are dressed like this because you are strata 6, or you cannot pay this or do that because you are strata 1. So at the beginning was just to make this division for public services, but nowadays the strata make a division for people as it. So we can see here that most of LGBT are in the 3 strata, and for general in Colombia, the numbers are the same. Most of our people is in the 3 strata, but for example, for the transgender, most of them are in the 2 strata. So they receive lower incomes, and they are living in neighborhoods that are not that good as LGBT. Amy, please.
Good afternoon, everyone. First, thank you to Ilan and Prince and Jennifer and team for involving me in this work. It's very important work, and especially what I have appreciated about this initiative, or sort of watching from a distance how it unfolds, is that I believe Ilan's team at the Williams Institute very much supports sort of investing and leveraging academic power and talent in Colombia and in the Global South in particular. So, you know, Jennifer and Prince's team at different universities in Colombia, I feel like, you know, the meetings that they have been holding around kind of just imagining how to use these data for advocacy purposes and human rights purposes in the country. I think that's really exciting, so thank you. I will be sharing the slides that you see have different photographs from activist work that I was involved in Colombia for many years. Before coming to UCLA, I worked as an activist scholar, both as part of a human rights organization based in Bogota that advocated for and along with trans sex workers and other street-connected communities that experience multiple forms of violence in public spaces in cities at the hands of illegally armed actors, and also worked as a professor at a research university in Bogota. So this photograph is a picture of a protest. We have led many street-level protests against violence exerted against trans sex workers in Colombia. I am showing you this because I feel that sort of revealing the types of narratives that I'm going to share in the following slides necessitates some sort of action for rights advocacy, denouncing in public spaces these forms of violence, and harrowing stories about how LGBTQ communities are treated in Colombia, the violence they're subjected to in the streets, in institutions in general. So this was a protest in the public transportation system. We kind of went through El Transmilenio in Bogotá is a BRT system in Bogotá, and the idea was occupying spaces that trans women are excluded from, and then ending in a shopping mall in the north of the city where trans identities and other sort of understandings of classed identities are excluded, right? So kind of occupying spaces of the city that these communities are kind of banished from, right? So, and we've also mobilized some of the narratives that I'm going to share with you in different settings in my previous institutions, so doing kind of art gallery work or exhibitions of narratives of violence, and then sort of public action against this violence in order to move a policy agenda, in order to process kind of controversial human rights cases and strategic litigation campaigns that were happening along with these initiatives, and having really trans women at the center of these activities. So the data the qualitative data that I will share, I will just share a few stories of both police violence and within Bogotá against trans sex workers, and also violence perpetrated by mostly right-wing paramilitary groups against trans women in their towns of origin. So we did a process that I refer to as emotional geographies or emotional cartographies, so sort of mapping trajectories of forced displacement, and then what are sort of the emotions that accompany those pathways of forced displacement. These cartographies, part of our research process in this project of between 2014 and 2016 was mapping out the trajectories of forced displacement at the hands of paramilitary actors. So you can see that one trans woman was displaced from Cartagena between different areas of the city, and then ending up in Bogotá, the capital city, kind of seeking refuge, but then being subjected to other forms of violence in Bogotá by the police and other forms of state violence, right? So these are sort of the patterns of, as we see in the data set of the project we're discussing today, violence against trans communities in general, and violence exerted against LGBTQ actors in general throughout Colombia are within this context of sort of 50 years of armed conflict, of sort of one of the important things to keep in mind is that these acts of forced displacement are due to gender identity in the case of trans women, right? So the data that I'm sharing are from a paper entitled Mobilities at Gunpoint that I wrote several years ago about how sort of the notion of forced displacement is often thought of like land grabbing and pushing communities in order to seize land. But in the case of the lives of these trans women, it is forced displacement due to gender identity, like banishing particular identities from small towns, from cities, from, you know, as a means of kind of removing trans women from space in general and annihilating their existence in the country. So I will read, let's see, that was supposed to have a quote here below. So one disclaimer, the interpretation of these quotes, right? The derogatory, homophobic and transphobic language doesn't necessarily translate as violent and harrowing as the terms are. But I will read these quotes as we have attempted to make sort of the most precise interpretation. So these two stories are about this process of forced displacement, right? So armed actors arrive at the household of trans women who are between, in this case, they were between the ages of 8 years old and 15 years old, I think, was the oldest trans woman in this particular study, and they're given a certain amount of time, saying you have 8 hours to leave the town, or we will kill your entire family, or this and this will happen, right? So I will read one of the quotes. They told us, "Motherfucking fag, I don't want to see you around here, or I'm going to shoot the hell out of you. You know I don't want to see you around here, motherfucking fag, gonorrhea," which is difficult to kind of translate, but it's used as mobilized, and this word is mobilized as sort of a stigmatizing insult, right? Then they fired gunshots in the air. "We give you 8 days to leave, or you know what will happen." They told my mom I had to leave because if not, they will kill her and everyone. Previously, this particular cartography, there was a quote that sort of one of the, I'm going to try to paraphrase what the exact quote says, but one of the trans women narrates that one of the threats issued is, "Good boys go to bed at a certain hour. Bad boys, like robbers, gays, junkies," and a slew of other derogatory, violent terms are put to sleep by us, right? And so that's kind of some of the threats that were issued around different households, and this is throughout Colombia, in order to sort of remove LGBTQ identities, and in this case, trans identities in particular, from particular spaces. And this is a case narrated by a trans woman about those who stayed behind in su pueblo, in the place where she was displaced from. And so I will read this. "Olimpo was left paralyzed. We were 7. From those 7, 3 remain alive. I'm fine, thank God. Olimpo is in a wheelchair. He was stabbed 8 times for being a fag because someone passed by and he said, 'What a hot boy,' and Pam. They stabbed him 8 times. 2 of them are living with a disability, the other one ended with a permanent limp, and the other one is me. 1 month later, they killed Ricardo, they chopped him up, and they put his penis inside his mouth and was found in the canal. They chopped him up with a machete." So these are sort of the stories of those who decided to stay, or decided to stay with their families, and these are kind of the results of what happened in some cases. And now I will share. So again, the big picture is that in this particular study, these trans women were forcibly displaced from their communities in other parts of Colombia, arrived to Bogota seeking refuge, and then engaging in the streets as the space where opportunities open through sex work and other street-connected activities are subjected to harrowing forms of police violence, right, where they are then banished again and told basically, like, you may not exist neither here nor there, right? That's kind of the point of this. So this is one of those cases. So this is in narrating a situation in Bogota, which is a plateau city, right? So you can imagine that these forms of banishment, these women are being taken to the outskirts of the city, right? Like up into the hills. They took us to the 11th station, and at midnight they said, okay, say your last prayers because we are going to kill you. They were going to kill us, so taken up to the hills. They started yelling, all of you take your clothes off in the patrol car. We had to go running down the hill naked. They chased us with gunshots. They forced us to jump into the freezing stream and left us soaked, without makeup, without anything, barefoot, without high heels, to simply bully and laugh at us, to banish us. This is torture. It was their entertainment, laughing at us getting wet. And so these are sort of the narratives that describe how the state is continuing to create these cycles of violence in urban spaces. And then this is sort of illustration of how trans women then mobilize HIV stigmas in order to deflect police violence. So they cut themselves, right? So if you can see that these women have cuts all over their arms, showing the blood to police in order to say, don't take me away, right? That, like, sort of mobilizing the stigma of their blood, right? Which is powerful and disturbing in many ways. And this is one of these practices of sort of resistance as a form of self-inflicting violence in order to deflect or avoid police violence in the streets. And so in these data that Jennifer and team will share, these are kind of the everyday contexts of how state violence operates in the lives of trans women and in general in the lives in public spaces, but also policing sort of the intimate, private spaces and lives of LGBTQ communities. And then I'll kind of skip over this, but these are just different advocacy initiatives over the years that we use to sort of mobilize human rights cases using these, some of the evidence that I have shared with you. So, thank you very much.
Hi everyone, I'm going to present the results of victimization, discrimination, suicidal thoughts, and attempted suicidal of the study. I will read my notes due to my English. I start talking about victimization. Victimization on LGBT population 18 and 29 years old. Victimization against LGBT population is characterized by attack or assault, robbery or vandalization, verbal insult, sexually assaulted, attempted attack or assault, and being victims of thrown objects. Verbal aggression was the most common type of aggression reported for LGBT people between 18 and 29 years old. 79% of transgender people and the 69% of LGBT between 18 and 29 years old reported have been victims of verbal aggression. The 44% of transgender people between 18 and 29 years old report they have been victims of thrown objects. 33% of them report they were hit, beaten, physically attacked, or sexually assaulted. Attack and assault. 27% say that someone tried to attack them, rob them, or damage their property, but they didn't succeed. 26% reported they were robbed or their property was stolen, vandalized, or purposely damaged, and 25% were sexually assaulted. In addition, 29% of LGBT people 18 and 29 years old reported they were robbed or vandalized. 27% were victims of attempted attack or assault and victims of thrown objects, and 20% of them reported have been victims of sexually assault and attack assault. 25% of transgender people, it's the same slide, of transgender people reported that victimization and discrimination related with sexual assault, robbery or vandalization, 22%, and attempted attack or assault, 24%, that was caused by armed groups outside the law, such as guerrillas and paramilitaries, among others. Now we are going to talk about victimization of LGBT population 30 and 49 years old. 62% of LGBT population and 69% in the transgender population of respondents aged between 30 and 49 years have also been victims of verbal insults or aggressions, followed by those who are victims through objects with 22% and 37% corresponding to each subgroup of the population observed. Also, you can see that physical aggression or abuse represent 24% of the LGBT population and 28% of the transgender population. 64 of LGBT people and 76 of transgender people reported they had been victims of verbal aggression. 58% of transgender people reported being attacked or assaulted, and 40% of LGBT people reported the same. Now let's talk about discrimination in LGBT people 18 and 29 years old. For LGBT people, bullying was the most reported type of discrimination. 69% of transgender people and 58% of LGBT people reported they had been victims of bullying. Job discrimination was the second type of discrimination that LGBT people between 18 and 29 years old reported. 44% of transgender people and 24% of LGBT people reported they have been discriminated in their jobs with job denials. Related to the police interaction, 21% of LGBT people reported they have been victims of verbal abuse, and 11% said that have been victims of physical abuse by police. On the other hand, 32% of transgender people reported verbal abuse, and 26% of them said that they had been victims of physical abuse by police. About discrimination against LGBT people 30 and 49 years old, bullying continues being the highest type of discrimination against the 30 and 49-year-old LGBT population. 46% of LGBT people and 57% of transgender people reported they have been victims of bullying. Job discrimination and promotion denials were reported by 28% of LGBT population and by 30% of transgender people. Bullying and promotion denial were the type of discrimination more reported by LGBT people 50 years old and older. Bullying was reported by the 38% of LGBT people and promotion denial by the 38% of them. Finally, in the case of transgender people, we found 66% of them reported they had been victims of bullying and 44% reported job discrimination. About suicidal thoughts, suicidal attempts, and self-harm in LGBT people in Colombia, 30 to 49 years old, we found that 55% of respondents had suicidal thoughts in their lifetime, and 1 in 4, 25%, had attempted suicide at least once. Bisexual women, the 33%, and transgender people, 31%, had a highest rate of suicide attempts, with 1 in 3 people reporting they had attempted suicide at least once. LGBT people between 18 and 19 years reported 60% suicidal attempts, 28%, and non-suicidal self-injury in 43%. Transgender men, 18 and 29 years old, had the highest percentages associated with suicidal thoughts and suicidal attempts. 78% of them presented suicidal thoughts. 52% presented suicide attempts. 12% reported having had minor or severe injuries, and 66% reported non-suicidal self-injury, or say that had suffered self-harm without the intention of committing suicide. Following transgender men, we found that 68% of the bisexual women presented suicidal thoughts, and 60% of them reported suicidal self-injury. Among people between 30 and 49, transgender men and bisexual women presented more suicidal thoughts, 60%, and 57% respectively. Transgender women were the ones who reported more suicide attempts, with the 33%, followed by bisexual women, 23%. Minor or severe damage occurred in greater percentages in gay men, 24%, and lesbian women, 21%. Finally, transgender men and transgender women between 30 and 49 years old are the ones who presented the highest non-suicidal self-injury, with 28%. For people over 50 in the LGBT population, transgender men reported the highest percentage of suicidal thoughts, 43%, suicidal attempts, 22%, severe self-harm, 33%, and non-suicidal self-injury with the 29%. And that was the results that we found. Thank you.
Okay, thank you. So it's easy to kind of gloss over all these numbers when you hear so many percentages, and to kind of really take it in when you think what it means that 80%, basically every person who is LGBT experiences harassment in the street. Or 60%, again, we just say 60% thought about suicide. That means like most people who are LGBT think about suicide. Now those numbers, we're used to seeing high numbers in the United States, and again in LGBT, and even more so in transgender population. And these numbers are way higher than those even. And to me, even though I'm used to seeing those numbers, you know, you kind of get accustomed to that. It was really devastating to see. And I think some of the presentations that Amy provided also gives this context to this kind of level of violence. Now, the assaults by police, for example, this is happening in big cities. So you can talk about some of the things that happen in the outskirts where there's right-wing military, paramilitary group where the government has little control, and that has been part of the peace agreement, is to try to address that, and hopefully it'll be successful. But we see that the problem is not just in the big cities, it's just not just in the remote places, but even in cities, as we saw in Amy's pictures from Bogota, but as you see, most of our people in our survey are from the big cities. They're in the big gay centers in Colombia. They're from Bogota, Barranquilla, Cartagena, and Medellin. So those are all cities. If you look at gay book guides, that's what they will tell you the gay centers are. And it's a wonderful country. I don't want to scare you about this, because this is the experience that LGBT people also have in the United States. But it is quite remarkable to see these numbers. And when we come to think about what we do with that in terms of moving forward, as Amy mentioned, we are working with a lot of researchers in Colombia and in the United States who are going to work on publishing data in scientific journals, but we're also working with local organizations that we hope would lead to, for the first time, have this data and show this data to the authorities, and maybe be able to work with police when you show them how frequently people experience violence from the police. That, I think Amy's story, which is like, we're all going to have nightmares about, those are extreme stories, but and the other side of it is the common experience, that you see that is almost like, I don't want to say which one is worse, but it's like, it's not just happened to the sex worker, transgender woman, which of course should not happen to anybody, but it happens to a lot of LGBT people, yeah.
Do you have any data about the rates at which non-LGBT people are bullied?
Well, we don't have that. We don't have that. But some of those, as you know, we didn't collect data on that here. But some of the data, Amy didn't mention the term, but the term that I've seen in a lot of those violence is called social cleansing, right? And they specifically target, especially transgender women and gay men, probably if they're more feminine. And so it is not random violence that they just kind of go around, but that probably happens too. But they target what they call like the bad boys or the bad people, and literally wants to exterminate them from existence. But this is the military, the paramilitary groups. In my mind, there's also what happened. The bullying was from school environments. And there was a famous case, do you want to talk about, what's his name?
Sergio.
Sergio, do you want to just explain that case? So when we talk about bullying in schools, there's also been a lot of discussions, and again, that's where we think that our data will help generate further discussion. You want to tell them about that case?
That happened like 3 years ago. His name was Sergio Rego. Sergio Rego was one of the best students in a very nice school in Bogota, but he started to receive a lot of bullying from his professors and also other students that they were not agree with they disagree with the relationship that he had with another kid of his class. So he decided at the end, he was a very good writer, so he decided at the end he sent a letter about all the bullying that the school did to him. He decided to suicide.
Good.
So after this case, her mom started a foundation, and she exposed all the case in the authorities and also in the education ministry. So at the end, the result was that the school had to apologize to the family and to create like
Sculpture.
like a sculpture in the entrance of the of the school in order to set that that wasn't a school that allowed people to develop his or her personality without any issues. So this was a really important case for the whole country and for all the schools.
But then after that, there were a lot of parents who objected, kind of just like we see in the United States, to the idea that there will be more tolerance to.
Yeah, you know that there are not always people happy. So
Right.
They
I'm
were just
saying that even
unhappy
after-
people with these kind of issues.
Yeah. One thing that we didn't show is what I pointed here in the last bullet, which is the high proportion of sexual orientation change efforts or conversion therapy that occurs there. Now, as Prince said before, Colombia is a Catholic country, and we know that Catholics are actually not on the scale of religious kind of oppression. They're not as bad as some other groups like evangelical, but still we see that 1 in 5 people experience social orientation change. In the United States, we estimated at 7%, and we think it's a really terrible problem, and you see all the laws trying to change. Yeah.
One thing, I love your presentation. That's a huge sample, which is great. You've got so many. How do you situate all of these issues with the other big political change in Colombia, with the FARC, the left-wing guerrillas being resettled? And I guess I wanted, you think about the paramilitares being very discriminatory, but where is the FARC in all of this?
Right, so let me actually, because there's an interesting story about the FARC and the peace agreement and how LGBT rights entered into that they can talk about. Let me just finish by saying some of our recommendations, and then we'll get back to that. And so we're going to recommend that they first of all begin to track data about LGBT people. We want to see implementation of prevention strategies that include police violence as well as self-harm and suicide. And there's another finding that is emerging that is of, I want to bring it here because we're in the United States, of American exportation of religious interventions that are oppressive to LGBT population. And we see this in all over South America and other parts of course, we know Africa and Russia, where evangelical American groups go having figured that they're kind of losing the battle within the United States, at least they used to think that, they're moving to Colombia and to many other countries. So that's another danger against all the advancements that have happened with LGBT rights, that a right-wing party, as we see now in Chile, can begin to turn back some of this, as we see in Chile, as we see in the United States, actually. So, Amy or Printing, or do you want to talk about you explained to me how the debate about FARC and the peace agreement kind of involved LGBT rights, because they were trying to say that it's, do you want to talk about that?
Do you know? In my funny English, I will try to explain. Okay. The point is that in the peace process, there was a document. They have like a lot of assignments to be discussed in Colombia for the whole people, not only in the government. So one of these politics, or one of these statements tried to said that Colombia will be open with the gender identity in the schools, and also will protect all LGBT people, and more or less that was what the document tried to say. So this was one of the reasons of the Christians and Protestants, and also a lot of government sides took in order to say no to the process, because they were